All right, the future of medicine is here, and stem cells, they're going to be a big part of the future. Here to talk more about the subject is Dr. Tamara Rogers and also Dr. Wendy Askew. How are y'all doing, doctors?
Morning, Paul.
Morning. All right. I'm fascinated by this. This
Absolutely.
is really amazing stuff, and I think it is going to be the future of medicine. But first of all, let's start off with this. We've got some balloons. These are going to be for demonstration purposes. First question, though. What are stem cells?
Yes, so Paul, stem cells are our body's own natural repair mechanism when damage or disease causes some dysfunction within us. And stem cells are a special type of cell that possess some properties that the other cells in our bodies don't have. And my little props here are to help illustrate that.
Okay.
So our stem cells have the ability to divide and make more of themselves almost indefinitely.
My question is, what makes stem cells so special? How can they do that?
That's the second property. One is that they keep doing that. All those things are very, very scientific, like how they make more copies of themselves. But your question is, the second property of stem cells that makes them so important in repair is that they possess the ability to change into whatever type of cell we need.
So they can morph
Yes.
Well, that's pretty good. It's like camouflaged, I guess.
Well, yeah, we call it differentiation.
Okay.
And so these cells that are lying dormant don't have the directions to make skin or muscle or anything.
So it's like a template.
Correct. That's a good analogy. But when something is damaged, say it's a heart muscle, when I have a heart attack, then these cells get activated and they migrate to the area of damage in response to signaling messengers that send out inflammation and injured signals, and they turn into heart muscle cells to repair. Or if I have chronic obstructive pulmonary disease, COPD, they might turn into a lung cell, a tendon cell, a skin cell. Whatever is damaged, they will respond and differentiate into that form of cell.
That is amazing. So they're kind of like soldiers just waiting for instruction.
Yep, that's exactly what they are.
And so they'll go in there and they'll heal or repair whatever needs to be repaired. Now, the question is, can you get the stem cells from anywhere? Fat cells, bone marrow?
There are different sources, and so we are not working with embryonic. We always want to make that very clear. That's so controversial, and we are not working with them. The most common sources used for stem cells are bone marrow and fat. And there's different properties of each tissue, although there's a lot of overlap. But we are working with stem cells harvest from each patient's own individual bodies. So we harvest them from fat in a mini liposuction procedure, process them very specially so that we have isolated stem cells and growth factors that can be given back to the patients to migrate to the area of damage or injury and do repair.
Wow, so that way you don't have any problem with, what is that, rejection and stuff like that.
Yep.
Yeah. Right. Dr. Rogers, I've got to ask you, how important is the International Review Board? Tell me about that.
Basically what they're trying to do is right now it's investigational, but they want to have some oversight to make it safer for the patient, so they're reviewing all of our data. So once we actually harvest and we give back the stem cells, we actually track these patients for 5 years so we can continue to collect the data. So there's been over 7,000 cases so far doing it the way that we do it under the IRB.
That's a lot. And who's a good candidate?
So patients that are a good candidate, you know, what we're seeing is patients that have, especially like joint disease, because we can put the stem cells directly into the joint. So we have patients that are now running again, somebody that's told they're going to need a total knee, but all their ligaments and everything's good, it's just a cartilage problem. People that have COPD, because we know the stem cells will actually, once they end up working in the body, go to the top of the lungs to repair people that have smoked for years. We're looking at people that have muscular dystrophy, multiple sclerosis, autoimmune diseases.
So somebody's watching right now and they feel like they're a good candidate. What should they do?
They should basically give us a call. We do consultations and basically a pre-op evaluation for the patient.
All right, so where healthy living matters, of course, Dr. Rogers Centers, you can give them a call. Give them a call right now, 210-495-2117, or you can go to drrogerscenters.com. And I think this is just fantastic. It's phenomenal what these stem cells are doing and what you guys are doing.
It's exciting, almost as exciting as the Kylie Jenner baby, but it's good.
Almost as exciting. Matter of fact, I'd even say it's even more exciting than
I
that.
think so. Yeah.
That's great. Appreciate it. Thanks for being on the show.
Thank you, Paul.
All right, you're going to help a lot of folks.